Welcome to the VOALA Adult ASI Questionnaire Introduction webinar. We will discuss on how to properly fill out the ASI questionnaire. The ASI is the Addiction Severity Index that provides a comprehensive intake assessment. It is a standardized, multi-focus screening and assessment tool. It is used to collect information regarding the nature and severity of problems substance abusers often have. The ASI is used to rate the severity of 6 problem areas. These problem areas, or better known as sections, include medical status, drug and alcohol use, legal status, family history, family and social relationships, and psychiatric status. There are a few interviewer instructions that need to be addressed before you can conduct the questionnaire. When conducting the ASI questionnaire, leave no blanks. It is important to collect all data, so do not skip any questions and leave them blank. If the question was not answered by the client, select either Not Answered, or if it does not apply, select Not Applicable. Secondly, make plenty of comments. The more information we can get from the client, the better we can assess the problem areas the client is having. If another person is reading the ASI, it should have a clear understanding of the client's situation and perceptions of his or her problems. Each question does not need to be asked exactly as written. Use paraphrasing appropriate to the particular client and record a brief explanation in the comments section. Remember, probing and writing comments when you have an unusual or counterintuitive answer is considered essential for a valid interview. Lastly, indicate the question number when making comments. When beginning the interview, it is important to properly introduce the ASI. This gives the client a clear idea of what to expect. Tell the client that all clients receive the same standard interview and that it should take about 45 minutes to complete. Also tell them that the ASI has 6 sections or problem areas that will be assessed. These 6 problem areas will be discussed based on 2 time periods, the past 30 days and lifetime. Lastly, all information is confidential and that the clients have the right to refuse to answer any question if they are uncomfortable to give an answer. We rather have no answer than a wrong one. At the end of each problem area, there are several questions that pertain to the client rating, interviewer rating, and competence rating. Client input is very important. For each problem area, the client will be asked to use a scale to let the interviewer know how bothered they have been by any problems and how important each treatment is in each section. These 2 questions are the client's severity rating. Explain that throughout the interview, the client will have the opportunity to convey their opinions about the information being discussed. Inform the client their opinion and perceptions are critical to the interview and treatment process. In order to standardize these assessments, we have employed a 5-point scale for clients to rate the severity of their problems and the extent to which they feel treatment for them is important. A 0 is not at all, 1 slightly, 2 moderately, 3 considerably, 4 extremely. For some clients, it is adequate to simply describe the scale and its values at the introduction to the interview and occasionally thereafter. For other clients, it may be necessary to arrive at an appropriate response in a different fashion. Getting the client to use his or her own language to express an opinion is more appropriate than forcing a choice from the scale. Below the client severity rating is the interviewer severity rating. The ASI interview defines severity as a need for treatment where there currently is none, or for an additional form or type of treatment where the patient is currently receiving other forms of treatment. These ratings should be based upon reports of amount, duration, and intensity of symptoms within a problem area. The following is a general guideline for the ratings. A 0 to 1 rating means that there is no real problems. Treatment is not indicated. While a 2 to 3 rating means that there is a slight problem. Treatment probably is not necessary. A 4 to 5 rating means that there's a moderate problem. Some treatment is indicated. A 6 to 7 rating means considerable problems. Treatment is necessary. Lastly, an 8 to 9 rating means that there are extreme problems. Treatment is absolutely necessary. It is important to note that these ratings are not intended as estimates of the client's potential benefit from treatment, but rather the extent to which some form of effective intervention is needed, regardless of whether that treatment is available or even is in existence. For example, a client with terminal cancer will warrant a medical severity rating of 9 if he or she were not currently receiving adequate treatment, indicating that treatment is absolutely necessary for this life-threatening condition. A high severity rating is recorded in this case even though no effective treatment is currently available. Clients presenting few problem symptoms or controlled symptom levels should be assigned a low-level rating. Very high severity rating should indicate dangerously high levels of problem symptoms and a corresponding high need for treatment. The last two questions in each section is the confidence rating. It appears as, is the information significantly distorted by the client's misrepresentation and client's inability to understand? These two questions have a yes or no answer. In regards to patient misrepresentation, we have found that some clients will respond in order to present a particular image to the interviewer. This generally results in inconsistent or inappropriate responses which become apparent during the course of the interview. As these responses become apparent, the interviewer should attempt to assure the client of the confidentiality of the data, re-explain the purpose of the interview, and clarify previous responses of questionable validity. You should select yes if it is obvious that the client is misrepresenting him or herself. For the second question, interviewers may find clients who are simply unable to grasp the basic concepts of the interview. This is usually due to the effects of drug or alcohol withdrawal, psychiatric impairment, or extreme states of emotion. If either of these cases becomes apparent, select yes for the patient's inability to understand the questions. Whenever a yes response is selected, the interviewer should record a brief explanation in the comments section. You are now ready to begin the adult ASI questionnaire. As a reminder, don't forget to probe, cross-check, and make plenty of comments. In addition, save often and make your best effort to have the encouraged questions answered.